Hello, this is Dr. David Green, CEO of the Florida Pain Network. Today's topic is the top 10 ways to avoid the need for a joint replacement. Well, what are the facts? There's over 1 million joint replacements performed each year in the U.S., with hospital stays typically 2 to 4 days. The average age for a knee replacement is 70 years. 6 out of 10 are women. The infection rates are 1 to 2%. There is a small risk of blood clot as well. Satisfaction rates for the knee is 90%, with 85% of artificial knees still working after 20 years. Now, joint replacement is a quality of life procedure. No one has to have one. Because the implants don't last forever, it's advisable to wait as long as possible to undergo a joint replacement. If you're young and have one, and you need a revision after 10, 15 years, because you're using it more than someone who might be older, then you're never going to have as good of a success as the first time you had the procedure done. The implants themselves are made of titanium, cobalt chrome, stainless steel, ceramic, polyethylene, which is basically plastic. So treatment option number 1 to avoid a joint replacement is activity avoidance. If the activity hurts, then either don't do it or do it less. Maybe institute some cross training, changing from running to swimming because it's less stressful on your joints. Number 2 option is over-the-counter medications such as anti-inflammatories, Tylenol, glucosamine, and chondroitin. The third option would be prescription medications. This might be a prescription pain cream or a patch, a higher dose of anti-inflammatories that aren't available over the counter. Celebrex is a possibility, and then possibly short-term opiates for when the pain becomes exacerbated. Long-term opiates for arthritis are a bad idea. Now, treatment option number 4 would be a TENS unit. This is a battery-powered device about the size of an iPod. It gives off a low-dose electrical stimulation through these foam pads, which are placed over the painful area, and it can change the way the brain perceives pain. Number 5 would be weight loss. Less joint stress means less potential damage to weight-bearing joints. Every pound you lose is 4 pounds less stress going through your hip or your knee joint. Losing weight with exercise may strengthen up the muscles around the arthritic joint as well, lessening your pain. Number 6 would be physical therapy. Strengthening up the muscles around the arthritic joint can take pressure off of those joints. In addition, modalities like ultrasound or electrical stimulation can also provide excellent pain relief, and stretching can also help with pain relief and improve your range of motion. Acupuncture at number 7. Several studies have looked at acupuncture for arthritic joints. Routinely, those studies show excellent benefit with such a low-risk procedure. Number 8, good old steroid injections. They've been done for decades, and it's never really been proven that steroids damage joint cartilage. It was shown in small animals. It was not repeated in the large animal studies, and it hasn't been definitively shown in humans. Typically, it's given every 3 months as needed. Keep in mind, they don't alter the disease course at all. They just provide pain relief and can be given every so often. Treatment option number 9 has been amazing. It's hyaluronic acid injections. You probably know it as Synvisc or Orthovisc or Hyalgan are the trade names. They're actually made from rooster combs, and the hyaluronic acid that is injected is very similar to what we have naturally. Our joints have a lot of hyaluronic acid, or they're supposed to, and that is a nice cushioning, lubricating function. When they did the large FDA study back in the late 90s looking at the hyaluronic acid injections, they actually showed an 80% good to excellent result for 6 months, and then at the 12-month point it was 65% good to excellent results. Really beneficial treatment. Treatment option number 10, we start shifting into the regenerative medicine injections, which would include platelet-rich plasma therapy along with stem cell injections, which could be either bone marrow derived, fat derived, which is also called adipose, or amniotic fluid derived, all of which have been shown to be excellent pain relieving injections for knee, hip, shoulder, ankle pain. So most patients are able to delay or avoid the need for a joint replacement, which is great if you're in your 40s, 50s, even 60s, to try and stave off as long as possible. Most joint replacements do end up fine, but there's always a chance of complications. It is a quality of life procedure. With the knee injections, it's been shown over 75% good to excellent results. The top non-operative pain management in Florida is through the Florida Pain Network. There are many participating clinics throughout the state. Over 50 insurances are accepted, and over 25 treatment options are provided with the board-certified, award-winning doctors. Visit us online today in the Tampa area for painmanagementtampa.com. And then call us for more information and scheduling at 813-666-4399. I'm Dr. David Green with the Florida Pain Network. Your pain stops here.